Hello and welcome to SentencingStats.com. I am Mark Allenbaugh. It is December 26th, and we are going to do about a 30-minute presentation here updating everybody on what's going on with the Bureau of Prisons. This is a follow-on or a follow-up to our December 7th update, and we're going to review some of those numbers so you can see how much has changed this month. So the BOP, as we'll see, remains at near record active infections for inmates and staff. There have been 186 deaths so far, including 2 staff members. 88 of 193 BOP facilities remain over capacity, which to my mind is rather shocking this far into the pandemic. And the overall average capacity, in other words, on average, each institution is about 96.6% at its capacity. So that what that means is, and we'll see here, that a lot of institutions, 88 of them are over capacity and the rest are close to their capacity. Only a handful are, let's say, like 75% or less. Obviously, the lower you're at, the lower capacity that an institution is at, that generally the safer it's going to be for inmates and staff in terms of spread of the infection. And one of the 11 private facilities that the BOP contracts with, one remains over capacity, but the average capacity rating is a bit better at just under 75%. So back on December 7th, this is what the active and the active infections look like and the number of deaths. As we can see, back on December 7th, we were at 5,073 active inmate infections, 1,564 active staff infections, and 163 deaths. As of December 23rd, which was the latest available data from the BOP, you can see it's gone up considerably. We're now at 6,658 active infections and growing, down from 7,278, but that was a short-lived downward trend, as you can see. 1,616 active staff infections and now 186 total deaths, which again includes 2 staff deaths as well as 12 deaths from the private institutions. What's interesting about this, though, and as I mentioned last time, is how different these trend lines are between the inmates and staff, and it's a cause for concern. The reason why the active infections for inmates are so dynamic is the BOP appears to consider inmates recovered using a very crude methodology, and that is, if you're not dead in 14 days, 10 to 14 days, I think it's about 10 days is what they're using. If you're not dead within 10 days of being confirmed infected, then you're recovered. And so that's why you see these big spikes here. There's some more explanation for this, but at this juncture, just once an inmate reaches 10 days and is still alive, then they're recovered, they're off the active list, so the infections go down. And as we're going to see later in the presentation, when the BOP does testing at facilities, the BOP isn't constantly testing inmates at any of its facilities. Rather, something flags, somebody decides at a particular institution a flag is hit or some variable is hit, and we're not sure what it is, and they decide to test. And when they test, they don't test en masse, they don't test everybody, but they test a fair chunk, and they discover there's a lot of inmates infected here, and then they stop testing. Once they see that the number of inmates infected are growing, they just stop testing, and then that artificially shows that the inmates are recovered because a lot of them, thankfully, aren't dying from the infections. But that doesn't mean that they're recovered, as we well know. And this 10 days is a good rule of thumb, perhaps, out in the community. If you're a doctor, say, at a community hospital, and you're just reporting to the state, people who are presumed recovered or something along those lines. But to use such a rule of thumb in a prison setting, I think, is quite dangerous, and it gives the wrong indication to courts and other decision makers that an outbreak at a particular facility may be under control. Again, I'm going to return to this in detail, looking at 3 case studies from 3 specific institutions. At any rate, so here again, the reason why we see these big spikes and these changes, because of the arbitrary decision to consider inmates recovered. Obviously, the same isn't being applied here to staff. And you can see here, this just keeps growing and growing and growing. Only recently has there been a downward trend. And staff are same biology, same species as the inmates, so there's no medical reason why they shouldn't be recovering and inmates continue to recover. This is most striking when you look at the rates of recovery, and what this chart compares is the rate of recovery between inmates and staff. And as you can see, once starting in April, the rate of recovery was about the same for inmates and staff. And the rate of recovery is just take the number that have been infected and the ratio to the number recovered. Simple as that. And as you can see, it was growing and growing and growing, and it got to around 80% for both. But then something happened towards the end of July where the BOP decided, well, we're going to modify how we count recovered inmates. That's the only explanation for such a dramatic change when the number of recovered were going down. And all of a sudden, the number of recovered increased, and the rate of recovery increased dramatically and has stayed above 80%, except for a minor dip earlier this month. But it's stayed above 80% since early August. Whereas, in contrast, the rate of recovery for staff has remained around 2/3, or just under 2/3, since that same period of time. And you can see they model kind of that they look similar. When this goes down, this goes down. So the only thing that I can think of is, one, staff may be reluctant to return to work, and that's understandable, especially this far into a pandemic, with lack of PPE being circulated at many of these facilities, or adequate PPE, and the facilities being some of them over capacity and others close to capacity. So many staff have been complaining. This is easily verifiable through various press articles and interviews with union heads for correctional officers. Many of the staff, from what I understand, are continuing to claim workers' compensation, so they don't have to return to work until they're medically cleared. And they're not getting medically cleared because once infected, you're not necessarily recovered automatically within 10 days. As we all know from the press over the last several months, there's something called long hauler syndrome, which in shorthand is just that it could take a long time for somebody to recover from an infection of COVID-19. And that's obviously occurring with the staff, but not the inmates, apparently. And that just goes to show that whatever methodology that the BOP is utilizing to determine when an inmate is recovered is far from accurate. Indeed, it is misleading, as these charts here indicate. So let's move on here. This is just a quick comparison to the total number of active infections. This is grouping inmates and staff together. Again, we can see the dynamic of this. That's mainly, as we saw, it's driven by inmates and not staff. But lumping them all together, the reason why I'm showing this here, the contrast is to compare the overall inmate population to active infections. And as I mentioned previously, and as many experts have already testified in courts across the nation, they've testified to the very obvious observation that the more inmates you have, the more likely you are to spread the infection. The infection is going to stay within a particular institution. Less inmates, better. Less inmates is the best way to combat the spread of any infectious disease, and especially, of course, COVID-19. So what we can see here, though, is that where the BOP started at about 170,000 back in mid-April, it's not even dropped 20,000 inmates. It has not reduced its population by more than 20,000 inmates since that time, and has actually, the rate of decrease has slowed dramatically since around July. And now inmates are just more or less trickling out of the institutions. All the while, the number of active infections continue to increase significantly. So, as a matter of fact, this now that I'm looking at it, this is this is the December 7th chart. So, excuse me. Let's see what happens here when we look at now December 23. So now we can see, as I was saying, it increased dramatically. So we went from 6,637 active at the beginning of the month to now 8,274 active at the beginning of the month, or at this time as of December 23rd. And again, what I was indicating with respect to number recovered, this number almost assuredly is much, much higher, because the BOP is using a very arbitrary and unscientific definition, whatever that is, of recovery. And yes, the BOP does not articulate, at least anywhere that's obvious on its website, what it considers to be recovered. And again, these big drops after there's been a surge indicate that whatever definition that is, it's quite arbitrary, because you're not seeing the same phenomena, or you're not seeing the same trend with respect to staff. So this shows cumulative infections over time. This was as of December 7th. And we could see here there have been, as of the beginning of the month, there were just over 30,000 cumulative infections of inmates and staff. And here I'm comparing the cumulative infections to the population of home confinement. This isn't the number that have been released to home confinement, but rather the current population on home confinement under the Bureau of Prisons authority. These are not inmates that have been released, that have completed their sentence and now are serving, let's say, home confinement as a condition of supervised release under the supervision of a federal court, but rather these are inmates that have been transferred to home confinement, are still considered inmates, and they are under the authority of the BOP. The BOP touts this, if you look at the website, as evidence that they have of what they're doing to combat the virus. They throw out these big numbers to try to, in my opinion, mislead that they are transferring thousands of inmates to home confinement to get them out of prisons to make it safer. Well, here, their own numbers belie that. Since they had one big jump at the beginning of July, and since that time, they've barely, the population of inmates on BOP home confinement has increased barely by 1,300. At the same time, over 23,000 inmates and staff have become infected. So this isn't enough. Obviously, the point is of this chart is it's showing that the BOP is not transferring enough inmates to home confinement to offset the growing and accelerating spread of the virus within its various institutions. This chart now shows, these are the numbers as of just a few days ago, as of December 23. We can see it's increased considerably. At the beginning of the month, 31,000. We've gone up almost 10,000 additional infections in less than a month. And as a matter of fact, there are less inmates on home confinement now than there were at the beginning of the month. Beginning of the month, there were 8,081. Now there's only 8,020. So now some of that may be because inmates have completed their time on home confinement and completed their sentence and no longer are in BOP custody. And that very well could be the case. And that frankly might explain that small difference. But just to double check, what this shows here, again, this is BOP data. These are the number of inmates that have been released from BOP custody due to sentence completion. And by sentence completion, that doesn't just mean those inmates that have been released from a federal institution, because some inmates towards the end of their sentence are transferred to home confinement for around 6 months or so. So this includes those that have been transferred under BOP authority to home confinement and then released from that home confinement, because that would be considered the end of their sentence. So again, this is everybody under BOP authority that has been released, has been completed their sentence. And I went back 5 years to January 2016, and there's just this little red line here is just a trend line. But as you can see, not much has changed. The latest data only goes to September of this year, but we can see here not much has changed. So you would think that more inmates would be released. Now, over these months here, there is a decline. There is a decline here, and if that trend continues, then there would be some evidence that the BOP is transferring more inmates, perhaps to home confinement, or more motions for compassionate release have been granted. But just looking at the population of those on home confinement alone, there's no indication that the BOP has increased this. In other words, the number of inmates now on home confinement very well may and certainly does include those that would have been transferred on home confinement anyway pre-pandemic. And so what a more meaningful variable or data point would be for the BOP to release are those that have been transferred to home confinement early as a result of the pandemic, pursuant to former AG Barr's memoranda back in March and April of this year, where he asked the BOP to release more and more, as many inmates as possible, or transfer them to home confinement. But the data do not indicate that is happening in any significant way, certainly not enough to offset the growing spread of the virus, which again is accelerating. And so this chart now, we're talking about testing, and we're going to discuss that a bit more. As a matter of fact, let's go I'm going to skip this real quick, come back to it in a second. So this chart looks at causes of death. And so far, there have been, as I said, 186 total deaths as a result of COVID-19, which include 2 staff. So excluding those 2 staff, there have been a total of 184 inmate deaths. And I went through this last time on our December 7th update. And that 184, it doesn't seem like a lot when we're used to hearing about 330,000 dead nationwide, several thousand in any particular state, several hundred in a city. So 184, again, doesn't seem like a lot. So one must give these numbers context, which is what we're attempting to do here. So from 2001 through 2016, there were a total inmate deaths. Let me rephrase that. From 2001 through 2016, accidents caused a total inmate deaths of 81. I'm not sure why I can't say that well, but hopefully you get the point from the illustration. There were only 81 inmates that died from accidents through that 16-year period, 2001 through 2016. In less than a year, we've already had 184 die from COVID-19. These were the total deaths from homicide over 16 years. And in less than a year, 184 deaths from COVID-19. AIDS, also an infectious disease, but thankfully not one that's airborne. But that caused 161 deaths over a period of 16 years, again in less than a year. COVID-19 has killed 184 inmates. Total deaths by suicide over a 16-year period are 216. So far, again, 184 deaths from COVID-19. But the point simply is here that is quite dramatic to see, to put this in context, how deadly COVID-19 is. But here, let's look at one more chart on this, and I think this is even more stunning. It really puts it in context, how deadly this disease has been within the Bureau of Prisons. Okay, so what I did here is I took that 184 deaths and I annualized it out to March. It was March 21, I believe, was the first identified infection within the Bureau of Prisons. So at the current rate of deaths that the BOP is experiencing, it will suffer 241 deaths by this coming March within the first year of the infection. So when you annualize it out, it's even more dramatic. So again, taking those deaths by accident and homicide, remember those numbers were for over a 16-year period for an average of only just over 5 deaths a year for accidents, 10 for homicide, just a hair over 10 for AIDS, and 16.3 for suicide. This, in a year, completely dwarfs those. COVID-19 is over 10 times as deadly as suicide, which is just breathtaking when one thinks about that. In fact, in any given year, from all sources, all causes, whether it's heart attack, another infectious disease, homicide, etc., the BOP experiences only 374 deaths on average. And COVID-19 now is well over, will make up over half of all those deaths. In other words, it's on average, statistically, it's going to increase the number of deaths by 50% that the BOP experiences. I've researched, I'm pretty certain that COVID-19 is now the deadliest single event in the 90-year history of the Bureau of Prisons. There's never been anything as deadly within a single year as COVID-19. And before we get into testing, just now to jump back briefly to the average average capacity that various institutions are at, or at individual institutions. What this almost looks like a bad painting or something along those lines. What we've done here is track the percentage of rated capacity. Each institution has a rated capacity of how many inmates, the maximum number of inmates it should have. That doesn't mean that's the maximum number of inmates that it can have. You can always stuff, unfortunately, you can always stuff more inmates into a particular institution. But each institution nonetheless has a rated capacity. That's the ideal maximum. And what this chart shows is what percentage for all 193 of those of the BOP institutions. So I'm excluding the 11 private ones here. But of those 193 BOP facilities, BOP institutions, what was their on these key dates, as you could see below, what was their percent? What percent of their capacity were they at that particular time? And it's a bit of a mess, but what the big takeaway here is when you look at the average, the overall average here in the middle with this red dotted line, you can see they started way back at the end of July at just over 101% of capacity. That was the average. It's trickled down to only 96.6% today. And everybody, this is about the 100% line. So all these institutions up here are over their rated capacity, with one here that just shot up dramatically. As a matter of fact, it's not shown here, but that's the camp at Terre Haute. So back in the around November 12th, their inmate population just went through the roof, most likely as the result of trying to move inmates around and try to make more room somewhere else. But that, unfortunately, has stayed up there. They haven't decreased the population there, so it's primed, unfortunately, for a massive outbreak. That would be one facility that I'd watch closely. So the ultimate takeaway of this, what's disturbing to my eye when I look at this, is, again, all these lines up here above 100%, and the fact that there are so many lines down here that are close to 100%. Around here is obviously safer, around the 50% mark, and there, as I previously indicated, there's only a handful of institutions that have remained down here, and some that started out low have gone, as we can see here, this particular line, up quite high to well over their capacity. Okay. So now let's look at a couple of institutions here, and we're going to go back to my theme about recoveries and how the number recovered is misleading, and there's a problem going on with testing at the Bureau of Prisons. So actually, before I jump in there, let me get back to this particular slide real quick that I skipped over. So what this slide shows is what you could roughly call the positivity rate. Now, technically, what the positivity rate is, when we look at that at the state level or a city level or even the entire United States, as you take a set number of people that have been tested for COVID-19, and then out of that set, what number came back positive. So if you test 100 people and 25 come back positive, you have a positivity rate of 25%. Now, unfortunately, we can't be that accurate. We should, but we can't be that accurate with the Bureau of Prisons, because the Bureau of Prisons doesn't, first of all, it doesn't report the positivity rate, and second, it just reports how many tests have been completed or are pending, but on a particular day. But we don't know, for those tests that have been completed, how many of those tests that have been completed translated into active infections that were, in other words, that came back positive. So what this chart basically shows is, what we do here is we're just tracking the number of total tests reported each day and the total number of positives that are reported each day by the Bureau of Prisons. And we come up with a ratio that this is that red line, which is basically what I call the percent of all tests positive. So this is, if you will, an overall positivity rate, but not strictly speaking a positivity rate as understood in the general public. Nonetheless, it's bad, and it's growing. And that's what this red line shows here. So now, as of December 23rd, 37.8% of all inmates that have been tested by the Bureau of Prisons have come back positive. Now, this is going all the way back, frankly, to March, but we start here in June. This is going all the way back to around June, which is when I believe the BOP first started reporting on on its testing. So what all these little lines here indicate, the blue, these are the number of tests that have been performed each day. So if the BOP reports on day one that there's 100 tests, and then day two a cumulative total of 150, then on day two they performed 50 tests. That's how we interpret their data. So that's what the blue columns indicate, the number of daily tests, and the orange, the number of daily positives. Now, as you can see, they don't map onto each other, because on some days the number of positives are greater than the number of tests performed. So obviously that's what I was explaining earlier, why this isn't strictly speaking a positivity rate, because it's kind of a mishmash of the way the BOP is reporting. I think what they're doing is they're just reporting whenever they do a test, whenever it's reported to them that they've done a test, they just spit that out. And then whenever a positive result comes back, maybe it's 15 minutes after a test or 15 days after a test, whenever they get that, they just report that then too. So you can't match the positives to a particular batch of tests, unfortunately. But nonetheless, what we are seeing is here, what the blue line here indicates, this blue trend line, this blue dotted trend line, is that the number of tests are increasing, generally speaking. But what's really increasing at a fast clip are the number of positives. So that's what this indicates up here, this ratio between the total number of tests and the total number of positives are increasing. So the BOP is testing more and finding more positives, which is bad. It's very bad because the BOP is so overcrowded right now. So many institutions are overcrowded. So the importance of this, the takeaway though, is when the government or the BOP itself states there are no infections at this institution, it is incredibly important to ask then, or to determine, how much testing is being done. Because if there is no testing, then it's meaningless to say that there are no infections. Nobody knows. And frankly, at this point, there most likely are infections at a particular institution. They're just not looking. So let's look at 3 case studies here before we wind up. Just if you could bear with me for about another 10 minutes, 5-10 minutes. So this is FCI Texarkana. And this is just going back to the beginning of November. And as you can see, here, this blue line, these are the number of active inmate infections that FCI Texarkana was reporting at the beginning of November, and there was 0. But why were there 0? Because there were no tests being performed. That's what these pink and red columns indicate. They're stacked columns. The red is just the number of completed tests reported on a particular day for that institution, and the pink are the number of pending tests reported on a particular day for that institution, and I just stack them together. So you can see there's very little tests being performed, but lo and behold, something happened. Something happened in early November, around the second week of November, to prompt some tests to be done. And lo and behold, it starts to go up as more and more tests are being done. Within a 2-week period, the number of active infections, once testing starts to be undertaken at FCI Texarkana, it increases 20-fold, almost 20-fold, from 12 on November 15th to 231 on November 30th. And testing keeps going, and as testing keeps being performed, the number of active infections keep going up. Now notice, this is not like a huge spike. It's not as if within 2 days or in a day it goes from 12 to 405. It takes about a month for FCI Texarkana to max out to 405 because they're doing tests. But then what happens? There is no scientifically valid explanation for this. This dramatic drop from 405 by half all the way down to 187 in 2 days. Over 200 inmates magically are no longer infected when it grew slowly over a month and it drops in half and almost completely within a few days. Within just over a week, it drops from 405 to 81. Well, what's the big difference here? Well, first of all, they stopped testing. They're doing a little testing here, which probably is why it didn't drop completely, but then they stopped testing here, which is why it keeps dropping. So that's one explanation. Once you stop testing en masse, or when you start I should say en masse because they're not testing en masse. They're testing a lot of people, but there's close to 900 people at this, or inmates at this facility, and they're not testing all of them. But nonetheless, once you stop testing, obviously the number of active infected are going to drop. But also, I think what this indicates is that problematic, that kind of unknown variable of what they consider recovered. Now, to my mind, even if they're using a 7-day or a 10-day threshold, if you're still alive after 10 days, you're recovered, mathematically, this still wouldn't make sense because it would be a gradual trend down. As these guys go up, then their 10 days, once their 10 days comes due, then there will be a gradual decline as well, too. It would be more like a bell-shaped curve instead of Yosemite's half dome here. So, now, is this peculiar to FCI Texarkana? And by the way, the problem with this, too, is the government or a court, Bureau of Prisons, or a congressperson looking at this might say, well, look, whatever FCI Texarkana did, they got the virus under control, okay, because the number of active infections are down. But again, that's a problem. The truth is they haven't. It's just an arbitrary determination of what inmates are considered recovered. Now let's look at a couple other examples here quickly. Here's Victorville Medium, which is now in the midst of a significant outbreak. As you can see, kind of the same thing here. They actually were doing more testing, and they were doing some testing, and it doesn't look like they were finding anybody. But as they kept doing some testing, just a little bit, around November 30th, really at the beginning of this month, they were worried because they start doing a lot more testing. And when they start doing a lot more testing, boom, it does skyrocket. They find a whole bunch of people at once because they're doing a whole bunch of testing at once here. And it skyrockets. And then they stop for some reason. And they do some more testing. And it comes down, but now it's skyrocketing back up. They're not in full recovery by any stretch. I'll be curious to see if they continue doing more testing and what happens there. But this gives you an indication that when you test, what this picture shows you is that when you test, you might not find anything, which is a good thing. But sometimes you will. If you don't test, you certainly aren't going to find anything. So this is what FCI Victorville demonstrates here. And let's look at one last example here. FCI Allenwood. Allenwood had no infections for the longest period of time. Everything was fine there. And it should be very obvious from this picture why that was and why nobody should have had any faith in that. It's because they were doing no testing. They were doing zero testing. And this is why it's so important to understand BOP's data and what they are reporting. Because what they were reporting, there was something like 600 completed tests back in early November. But that 600 completed tests was from day one. And the way the BOP reports, it reports all the tests. Really what it's reporting is completed tests for a particular inmate. So if that number doesn't change, that means is nobody else is being tested. So if that 680, whatever it is, stays at 680 or 1,000 and stays at 1,000, then there are no new tests being performed, or there are no new inmates coming in that have been tested. It's one other way to interpret the data. But primarily it is that no new tests are being performed. That number has to increase to indicate that new tests are being performed or completed. And they also do report separately their pending tests, so that's very easy to track. And there were no pending tests all this time. And then sometime in early December, they start doing some testing. And I'm curious why. I'm curious what prompts them to do testing. This is something else that the BOP has not articulated anywhere in any of its memoranda and bulletins, etc., that at least I'm aware of, what prompts the BOP to perform a test or to start testing a number of people. But something prompted them to do at least a few tests here. Not a lot, as you can see, very, very few, but quickly they started seeing a number of infections. And those infections grew quickly from nothing to to 50 in the course of a week. And so somebody, probably the warden, said, we're going to test almost everybody. There's about 900 inmates at this facility right now. And they did a huge test on the 18th, got back 305 results. So that was indicative of concern. And as you can see, the number of active infections shot up to 152. So about 1 in 3 inmates that they had tested came back positive. So that was quite significant. And it's dropped a little bit. They haven't done any testing since. So this is another facility to monitor closely. So that wraps up our December 26th. Merry Christmas to everybody, by the way, and I hope we all have a happier New Year. But this wraps up our December 26th update. We'll try to put one more up before the end of the year to see what's happening and give an overall overview of where we see the BOP going for this coming year and some trends and issues to watch out for. So thank you for your time. Hope that you found this useful and informative.